So welcome back. We're going to be continuing our stages of development, and now we'll be talking about self-concept and parenting styles. So a self-concept is also a developmental milestone in children, and parents who are the primary caregiver can influence a child's self-concept through different parenting styles. The first type is authoritative style, in which the parent gives reasonable demands and consistent limits towards the child. They express warmth and affection and listen to the child's point of view. Parents set rules and explain the reasons behind them. They are also flexible and willing to make exceptions to the rules if needed. And authoritative styles is one of the most encouraged in American society. And American children raised by authoritative parents tend to have high self-esteem and good social skills. And an example of a parent who has an authoritative style may be Mrs. Incredible or Elastigirl from The Incredibles. She's very nurturing, gives reasonable demands and consistent limits to her two children, and she sets rules, but she's also flexible in bending those rules. The next parenting style is an authoritative style, which on the other hand is where a parent places high value on conformity and obedience. These parents are often strict and tightly monitor their children and express little warmth toward their children. These parents often expect the rules to be followed without any exceptions, and this style can create anxious, withdrawn, or unhappy kids. And one example of an authoritarian style, is Marlin from Finding Nemo. If you have seen the movie, Marlin is very controlling and expects Nemo to conform to his rule, and he expresses little warmth toward Nemo, and it's not until after Nemo becomes disappeared and lost that Marlin realizes that his style of parenting isn't that great. Next are permissive styles, in which parents make few demands and rarely use punishment. They tend to be very, very nurturing and loving, and they may play the role of a friend rather than a parent. And the child often makes the rules, and the parents allow them to make the rules. These children raised by permissive parents tend to lack self-discipline and may also contribute to other risky behaviors such as alcohol abuse. However, some positive outcomes associated with children raised by permissive parents is that they tend to have higher self-esteem, better social skills, and report lower levels of depression. And one example is Lilo, who is a parent to Stitch, or the owner of Stitch, and she is more like a friend to Stitch than really a parent or a caregiver, and this may be a permissive style. And the last style is uninvolved, in which parents are indifferent, uninvolved, and sometimes referred to as neglectful. They don't respond to a child's needs and make few demands. This could be because of depression or substance abuse among the parents, or other factors such as the parent's extreme focus on work. These parents may provide for the child's basic needs, but very little for anything else. And children raised in this parenting style are usually emotionally withdrawn, fearful, anxious, and perform poorly in school. If you have seen Meet the Robinsons, you might know Goob, who is an orphan and really had his parents who were uninvolved, and he turned out to be very anxious, fearful, and withdrawn from others. And our next stage of development is adolescence, and this is a period of development that begins at puberty and ends at emerging adulthood. And in this development, teens are going through physical developments that include puberty and changes in the primary and secondary sexual characteristics. primary sexual characteristics are organs specifically needed for reproduction, like the uterus and ovaries in females, and the testes in males. And then secondary sexual characteristics are physical signs of sexual maturation that do not directly involve sex organs. And these involve the development of breasts and hips in girls, and the development of facial hair and deepened voices in boys. And then girls also experience menarche, which is the beginning of the menstrual period, and boys experience spermarche, which is their first ejaculation. In adolescents, cognitive development expands as well. They develop cognitive empathy, also known as theory of mind, which is the ability to take on the perspective of others and feel concern for others. And this is an important component of social problem solving and conflict avoidance among different peers and family. So they might be developing some sexual characteristics, they're forming more friends and groups, and also developing their cognitive skills. And in regards to their pro-social development, this increases by refining their sense of self among their peers, so identifying their identity and pulling away from their parents' identities and what their parents think of them, and really taking on their own identity in their peer group. And then near the end of adolescence is when they emerged into adulthood, where they take on the beginning steps to becoming an adult. And in this stage of adulthood, in early adulthood, from 20 to 40, our physical abilities are at their peak, including muscle strength, reaction time, sensory abilities. And then in the middle adulthood, from 40 to 60, our bodies gradually decline. And then in late adulthood, from 60s and onward, this is the last stage of physical change, where the skin becomes loose and elastic, and reaction times are slower, and muscle strength gets weaker. And unlike our physical abilities, our cognitive abilities remain relatively steady throughout early and middle adulthood. However, in late adulthood, we begin to experience a decline in fluid intelligence, and these processes become slower. And then also, as we get older, socio-emotional selectivity theory suggests that our social support and friendships may decrease, but we may have one or two close friends as we get older. And then comes the last chapter of our life, old age and dying. And I just want to say that death is a natural process that greets us and marks our end of our story. A quote that I love about death is from Dumbledore in Harry Potter. And he says, "To the well-organized mind, death is but the next great adventure." And I really admire Dumbledore and his theories on death, thinking that death is just a natural cycle that marks the end of our story. In our old age, we also might experience hospice care, which is the ability to help and provide a death with dignity and pain management in a humane and comfortable environment, often in a hospital setting. And research has indicated that hospice care is beneficial for the patient and for the patient's family. Hospice patients report high levels of satisfaction, and they're not completely dependent on different strangers for care if they become familiar with the hospice care professionals. And hospice care patients tend to live longer than non-hospice care patients. And family members can receive emotional support and are informed about their loved ones' treatment and condition in these hospice care facilities. And then during the process of dying, either yourself or if you are dealing with a dying loved one, you might experience these different stages of grief. So denial, anger, bargaining, depression, and acceptance. And you could learn more about these in our textbook. This marks the end of our developmental chapter. Make sure you review all parts of the chapter and all parts of this video, and make sure you study development for your success in this class and for the test.